next speaker now is Marianne Takki, Healthier Together EU Non-Communicable Diseases Initiative team leader, DG Sante in the European Commission, where she's worked on several policies in the area of health services and public health since 2002. It's quite extensive experience and responsibility for the development of the European Union policy on non-communicable diseases and the new Member States Steering Group on Health Promotion, Disease Prevention and Management of Non-Communicable Diseases. Background is in medicine, an MD specialised in public health medicine and originally from Finland. So I'm sure we'll have some very interesting contributions to make to us. Again, a remote participant.
Yes, good afternoon and greetings from Luxembourg. And I would like to thank the European Parliament and Alzheimer Europe for organizing this event. So I would like to take you through very briefly Healthier Together EU NCDs initiative. So if I could have the slides, please. We have a team in our unit. Our unit is responsible for health promotion, disease prevention, financial instruments in DG Sante European Commission. And over the past 6 months, our team has been working very hard in creating a new framework on non-communicable diseases that require actions, impactful actions in the European Union. So I will briefly describe to you the actions and the process, and also then go into a bit more detail on mental health and neurological disorders. Next slide, please. Next slide, please. So in terms of the EU NCD initiative, the main aim is really to support member states in their actions tackling non-communicable diseases. It is for the first time a more systematic and comprehensive way of looking at the biggest major NCD areas in the European Union. It is both ambitious and innovative process because we, together with the member states, through the steering group that Madam Chair mentioned, we have identified national and EU priorities and actions that could be taken forward in 5 key areas. I will speak about those areas a little bit later on. It also identifies key legal and financial tools that could be used in taking forward the actions that the member states have identified. Now, what makes this process or initiative innovative is that it's not a top-down approach that we have used. Instead, we have co-created together with the member states and stakeholders with whom we have met at least, I think there have been 5 separate stakeholder webinars. We've discussed what are the interest areas or the priority areas also from stakeholders. So as a whole, we aim at having a set of priorities agreed with the member states and also supported by the stakeholders and targeting countries' needs in a systematic way. It also complements Europe's Beating Cancer Plan, which is the best known flagship initiative on NCDs. The complementary area is on health determinants, common risk factors, where we, together with the cancer colleagues and the cancer community, will aim at reducing the burden from the risk factors as well. Health inequalities is a horizontal area of work, as is, for example, generation of knowledge in health information and data. But we hope that with this EU NCD initiative, we, in a targeted way, can increase EU support to those areas where that is mostly needed. Next slide, please. So now in terms of scope of action, yes, thank you. Promotion and prevention is really the key on non-communicable diseases. And I think that's sort of an agreed scientific principle. Through health promotion and disease prevention, we can add value at the EU level to the actions that the member states are doing. And for several years now, together with the member states in the steering group, we have been able to identify and select best practices, but also promising practices, implementable research results, and then roll those out in the member states. These are, for example, related to nutrition or prescription of physical activity, which was a best practice developed by Sweden, but which has been now rolled out across Europe. But health promotion and disease prevention is really in the heart of our actions. But then again, on screening and early detection, this is of course something that we know well for the cancer area, but on cardiovascular diseases, diabetes, neurological, and even mental health area, screening of problems before they become bigger problems is of course something that member states have also now identified as possible areas for action. And then in terms of diagnosis and treatment management, we are not talking about, or we have not been discussing different treatments or therapies or medicines, because this is not about health technology assessment, but we've been discussing with the member states and stakeholders how to improve, for example, patient pathways, how to make sure that the patients are in the center of the decision making for their own health. And then knowledge and data are horizontal issues across the non-communicable diseases area and the initiative, because without a good scientific evidence, of course, it is very hard to create new innovative approaches. The quality of life is in the center of our working, and also it is linked to the work of the Europe Beats Cancer Plan. Next slide, please. So the strands, we have 5 strands, in fact, in the UNCD initiative. The first one is on cardiovascular diseases and diabetes. And that was the first area of discussion with the member states and stakeholders. And on the basis of those discussions, under the annual work plan for 2022 of the EU for Health program, there are no plans to carry on the work through collaborative actions between member states, but also looking at how the stakeholders could support implementation of actions. The next strand is on chronic respiratory diseases, and on that we also have had separate meetings, and there are some concrete areas where member states would like to prioritize actions, for example, on COPD or asthma. Then the third big area are the mental health and neurological disorders. And here I will say a little bit more in the next the following slides. But in any case, mental health, of course, it's not the first time we are developing actions on mental health. We've been working on that issue and challenge over 20 years. And I think Alzheimer Europe, who is in the room, knows well the previous projects we've had on mental health. On health determinants, which is the final strand, we have close collaboration with the cancer team in DG Sante, but also with the colleagues in DG Research, because health determinants is a cross-cutting strand between all the different areas, and we want to make sure that wherever we do actions, it also benefits other disease areas, of course. Now, best practices is a tool. Best practices I mentioned earlier. This is something where member states have a concrete example or tool that can be transferred, and it should be impactful and it should be transferable across Europe. We are now collecting best practices. We've had an open call for best practices, and that ended in mid-May, and we are now evaluating, and I think many stakeholders have sent very useful input, and we will following the evaluation, we will see whether there will be some directly implementable best practices covering any of these areas. And of course, policy reforms. The colleague from WHO mentioned the key importance of mental health reforms, moving towards more community care. We have an ongoing project, in fact, on that. Belgium developed a mental health reform, and that is being replicated now across Europe in many other member states. But especially in the area of mental health, I think the policy reform is something we would be looking at. Next slide, please. So this is just to sort of summarize two key issues. So first of all, we're talking about very practical toolkit. This is not just words and strategies and sort of telling that we are dealing with important things. This is really about identifying ambitious and impactful actions through the best practices, best buys from WHO, implementable research results, and innovative approaches and ideas. We have also mapped all legal, policy, and financial tools across the European Commission. We've had several meetings with the other services, European Investment Bank, to be able to have, for the first time, a full picture of all the funding programs that are being used or can be used to support the implementation of the actions that are identified in the EU NCD initiative. And then these are the two main pillars of our initiative, but this is not over yet. So basically the aim, although we have now, we are closer to the end of the meetings with the member states and stakeholders for this first phase of the initiative, we still continue to discuss with the member states through the steering group and with the stakeholders through the health policy platform until 27 to make sure that on an annual basis we can redefine and readjust the priorities for actions. Next slide, please. So in terms of the co-creation and the whole process, it's been extremely intensive, I suppose, not only for those who have been organizing the meetings and the work, but for the member states and the stakeholders. And I would like to also thank especially World Health Organization, who has contributed to the development of our initiative so that we are aligned with their actions as well. European Investment Bank, who is also very much actively contributing to the work of the steering group on public health in general, and other Commission services and EU agencies have been providing input. 52 stakeholders have provided written input, but we've had also 5 webinars with several stakeholder groups, NGOs, patient groups, health professional groups, etc. And as a result, we now aim at 22nd of June that we will have a high-level event hosted by Commissioner Kyriakides, and we will then present the final results of this process. Next slide, please. So now going a little bit more into the priority areas of mental health and neurological diseases. I'm not going to read this to you, but just to show you that in the area of mental health, these are the areas that the member states' health ministries have listed as key areas where they want to do work together. So now just taking a few examples and also linking to what the colleague from WHO said, we are also talking about increasing resilience on mental health both in peacetime, but also for future crises. There's also, there's been a notion from the member states that we should not forget other neurological diseases than dementia. But of course, we cannot list all of the diseases. So in terms of actions, we try to find comprehensive actions that can benefit not just one disease area, but many. Considering the theme of the day, there's also been, in particular related to Alzheimer's disease, prevention and early detection of dementia has been highlighted by the member states. Next slide, please. So now, on the basis of these priority areas from the member states and the stakeholders, we have already moved towards sort of a more practical approach. How can we turn the priorities now into something concrete, something where member states can jointly work together by using the funding from the EU for Health program? And we call them work packages, but they're actually work areas. This is not a ready-made project, but this is something where we try to see with the member states already where they would like to work together, and then to see how we can put more content and the planning into all of these areas. Dementia-friendly communities is still an important area of work, and especially implementation at local levels. Next slide, please. So I'm coming towards the end of the presentation. I mentioned the big event that the European Commission is organizing on 22nd of June. I hope that Alzheimer Europe and all the people in the room and online would register to this meeting. I think it's an interesting opportunity to hear more from Commissioner, from different speakers, European Parliament, the member of the European Parliament, Sara Serda, will be there as well, and to hear more about the different insights of different players who have contributed to this process, and to hear about the next steps. In concrete terms, we are using, of course, the EU for Health program as an implementing tool for the first time in the history of the health work, at least in my time in the European Commission. We have so many resources that can be targeted into health, and we're trying to seize the momentum through this NCD initiative, and to find the ways to create projects that can then take forward the work that has been developed under the initiative. And we will continue to discuss with the member states and stakeholders. We will continue on an annual basis, most likely, to discuss and revisit the priorities, and to see how we can develop projects and actions around these challenges that we are all facing together in Europe. So I would like to conclude here and just thank for the organizers for inviting DG Sante to this meeting. Thank you.